She'll take us through waist circumference and the health risk. There have been a lot of a lot of debate around what your BMI is. Should I be bothered about my BMI? My waist circumference, should I be bothered about it? For the ladies, is it just to have that body structure that they want, or has it got any health implications to it? And what can we do about it? So without doing much, I would hand over to Jasmine so that she can take us through to see what we can learn today from our waist circumference and what we can do about it, given the health risk it has. Yeah, thank you, Jasmine.
Thank you so much, and evening, everyone. I'm just going to get my screen up for sharing. Okay. Oh. Okay. Lovely. Right. So hopefully everyone can see that clearly.
Yeah, we can.
Thank you. So as has just been introduced, so the next hour or so, we're going to be kind of going through waist circumference, what it means for our health, and particularly what it means for our community. Like was mentioned, do we need to take it seriously? Do we need to focus more on our weight, our BMI? You know, what's the point in waist circumference, and why is it being done? Or why are we seeing it more kind of taken into account with consultations now? So again, so just to welcome you to today's sessions. We're going to be looking into waist circumference and particularly how it can be used as a predictor of health for health risk, specifically within the Black African and Black Caribbean population. So we're going to be starting with looking at the health risks that are associated kind of quite commonly within our groups, but also kind of looking at it globally and focusing on something called non-communicable diseases, or we're going into details of that. Also looking at how just how we identify risks and how BMI is used to do that, but also how waist circumference can be used to do that as well. Then they'll be looking at waist circumference specifically in relation to gender and ethnicity. And then we'll be ending with a few pointers on how we can work to reducing our waist circumference, if that's something that we need to do to either reduce health risks or to help manage any currently diagnosed non-communicable diseases that we might have. So just to start off with some facts, some health risks facts. So identifying health risks, particularly of those non-communicable health diseases. And when I say non-communicable diseases, I'm talking about type 2 diabetes, stroke, coronary heart disease, hypertension, and some cancers. And we really know that kind of getting that early intervention is really, really important to try, one, reduce it from happening, but also two, if it is something that can be treated, getting in there early is really, really important. So an estimated 80% of these non-communicable diseases are preventable. So, and by saying that, it means that these, not to say that they're self-inflicted, but it's more in terms of it's a response to the environment that we might be putting ourselves in, what sort of lifestyle choices we might have adapted or adopted, and also the sorts of foods and drinks that we might be taking in as well. Also thinking about our physical activity and how that can affect our risk of getting these non-communicable diseases, and whether or not we smoke as well can have an effect. So some early interventions which might be introduced might be things like medications such as statins to help reduce heart risk, or it might be hypertensives to help reduce blood pressure. But as for most, or as for a lot of people, trying the thought of having new or additional medication can sometimes be quite off-putting. So this is why we want to try and do things such as making lifestyle and diet changes to try and reduce our risk of getting these non-communicable diseases. What we know at the moment also is that these diseases such as diabetes, poor heart health, are quite prominent in low and middle income countries and low and middle income communities for a variety of reasons. Lack of access to healthcare services, lack of tailored support and information, lack of screening as well can result in these increased kind of prevalence of these of these conditions within low and middle income countries, with about 31.4 million deaths as a result of these a year globally, which is a huge amount. But like I said, detection, screening, and treatment are three of the key components that we can try and factor in to manage, reduce, address these non-communicable diseases as early as possible. Within the UK, we know that things like type 2 diabetes, poorer heart health, hypertension, and particular cancers are a lot more prevalent within Black ethnic minorities. Again, these are for a multiple of reasons, not just that we might be genetically predisposed to some of these conditions, but more so the lack of specific targeting and specific screening of these conditions can affect it. And also it's dependent on what parameters we're using to screen. So is it that the BMI ranges aren't set low enough so that we're catching these conditions early? But we'll get onto that in the next few slides. So when it comes to BMI, you probably may or may not be familiar with the term body mass index, and essentially it's a you may or may not know, but it's a simple kind of maths equation which takes your height squared, so we multiply it by itself, and then we also use your weight as well. So we're trying to kind of get a number that takes your height and weight into account to see if your weight is a good number for your height. The calculation in itself wasn't designed to be used on people, individually as a person. It's more used as a tool to measure kind of body mass across a population. So it's used to measure health risks for large amounts of people, not just taking one person to account. But even though it has been kind of designed for populations, it's still used for individual risk assessment. One, because it's quite convenient and it's quite simple to use, and it's quite kind of cheap and cost effective in terms of trying to put people's weight into different categories. The calculation in itself was based on European men back in the 1800s. And for context, within that time period, we had the Civil War, which started and ended, the American Civil War, which started and ended. And then that's also the decade where, the century, where antiseptics were just used in hospitals. So this is a very, very, very old equation that we're still using today. And as you can imagine, the population that we had in the 1800s versus the population we have now globally is vastly different, and we've got very different health risks that we're trying to manage than we would have had to deal with in the 1800s. So what is wrong with BMI? As I've mentioned, it doesn't take into account gender. So as we are probably aware, men and women, just body composition wise, we are different. Even if we just look at the just from a hormonal level, we are going to have, there are different hormones across the two genders, and that in itself kind of predisposes how fat is going to be distributed in the body. It also doesn't take into account muscle mass and the different muscle mass percentages that we have across the different genders. It also doesn't take into account bone density, nor does it take into account fluid retention. So BMI in itself, just from a gender perspective, has a few flaws. And then when we look at age, we know now that specifically when we kind of get to older age, having a higher BMI is actually advantageous as opposed to having a lower BMI. So if we were to kind of use the BMI chart as it stands, which suggests that ideally we should have a healthy range is between 20 and 25. But for an elderly person, we actually want to be them 25 and up. But for someone who isn't older, that puts them in the overweight obese category. So it sounds a bit contradictory, but we want someone who's an older age to be a higher BMI because it is protective in terms of their immune system. It protects their skins from pressure sores. If there was to be a fall, then in terms of recovery, they're more likely to recover quicker. And in terms of hospitalization, their length of stay is reduced, and then they're more likely, the chance of bounce back is also reduced if they have a higher BMI. And then we also have body composition, which I mentioned just before, and just how that changes within genders, but also if someone was very physically active, they're going to have more muscle, versus someone who's a bit more sedentary, they're going to have less muscle. So they might be the same weights, but the body composition in general is going to be very different. So again, BMI doesn't take into account what is actually, I guess, a good weight versus what isn't as a good weight for them. And then lastly, it doesn't take into account ethnicity. So we might have the same gender, the same age, but different ethnicities. And just because of genetic predispositions, being the same BMI doesn't necessarily mean that we're both healthy. So the BMI ranges for different ethnicities are going to be and should be within different catchments, which I'm going to go through momentarily as well. So this is where, I guess, waist circumference comes in now. So when we look at waist circumference and consider waist circumference, the reasons that it's starting to be used more so within a clinical setting is that it actually does take into account, it begins to take into account that of fat distribution and body composition, because it's seeing where most of our fat is being held and stored. We know that when weight is more when our fat is stored more centrally, so within our abdomen, kind of torso area, around our vital organs, things like our liver, our pancreas, our heart, our chance of having some of those non-communicable diseases I mentioned earlier are increased. So it just makes the body less effective and less able to kind of function and for it to react to the hormones that our bodies are producing as well. Another positive about waist circumference is that it can be measured at equal intervals. So in the same way that weight can and BMI can, waist circumference can also be measured, once a month, once every few months. So it can be tracked and we can see progress. Another great thing about it, it doesn't take much skill to measure waist circumference. And once we have that measurement, and when it comes to translating that into a risk level, it's a case of, similarly to BMI, using kind of a color wheel or sort of like a scale, and we can see what's a high risk, what's a medium risk, and what's a low risk. And it can also lead to more kind of body positive conversations, because weight in itself, for our community, it may not be the main concern, or people may not kind of have a desire to lose weight. But when we, particularly within kind of our women kind of groups, having conversations more around body shape and where that fat's being stored can be a bit more motivating. So as opposed to kind of having weight targets, having waist circumference targets can be a lot more of a productive conversation. So without trying to kind of state the obvious, it's just a kind of a few points on the sort of things we'd want to take in when it comes to measuring waist circumference. So it's not simply where your trousers would sit, or kind of directly across your belly button. We'd actually want to see where the bottom of our rib cage and the top of our hips are. Once we found that area, we would find the middle, and that tends to be just above the belly button. You would get your tape measurer, tightly put it around the area, but not so tight that it's digging into the skin. So Ideally, it should be kind of underclothes. So something that might be done in a clinic setting. Individuals might do it themselves at home. And then you want to naturally breathe out. So you're not holding your belly in, want to try and get an inaccurate measure. And then we'd repeat that because, things can happen. We're trying to get a bit of an average. So repeating it 3 times would be the best way, but just for time's sake, just doing that measurement twice. And we want to get that measurement. It could be in centimeters or inches. It doesn't matter. It's just dependent on kind of like on your preference. And just to kind of build on that, there is a really kind of good link on the British Heart Foundation, which has a little video on how this measurement will be taken. And there's also a preset kind of calculator in there as well, where you would select the gender, the ethnicity, whether it's centimeters or inches. And then once you put that information in, it tells the individual or the clinician whether or not that waist circumference is good for that person's gender, but also taking into their ethnicity into account, which is amazing. So just some things to note. So when it comes with waist circumference, it's one negative is that it can be slightly more invasive than, say, standing on some weighing scales, because there's no physical touch involved. But when it comes to taking waist circumference, say in the clinic setting, just something for any clinicians on the call or any health coaches who want to start implementing this into their practice, just don't assume that it's okay to go ahead and take a waist circumference. Obviously ask permission first, make sure you've built that rapport. Offer a chaperone if it's a man or a woman, just to kind of make the person feel comfortable. It might be worth kind of giving a demonstration so that, again, they feel at ease with the kind of practice of taking that measurement. It might be that if there's quite a lot of layers of clothes, obviously, because we're kind of in summer now, but if there's quite a lot of thick clothes or jackets, we'd ideally want those off so we can try and get as an accurate measure as possible. And within a clinic or a virtual setting, giving some verbal instructions, what I've just said earlier, kind of finding the middle between your lower rib cage and the top of your hips to allow that person to do it themselves. And also to make sure that you're planning in a follow-up. So you've got that number to then compare it to at a later time. Okay. Oh, I'm not too sure if you can see that well. Let me just go across a little bit. Okay, here we go. So this is what we have at the moment. So a lot of research has been done into kind of what would be classed as a healthy kind of waist circumference for an individual. So in this first table here, we've got this is the research that was already kind of available and what we were going off first. So for the general population, if a man, or also we split it into man and woman, male and female, with waist circumference within a kind of a below 94 centimeters, 37 inches, some of that person would be classed as low risk. And then for women, below 80 centimeters, 31.5 inches, again, so that would be within the low risk category. And then high, there's some parameters there as well, and then it goes into very high as well. But what's been realized is that these ranges aren't reflective within other ethnic groups, specifically within Black African, Black Caribbean, but also Chinese and South Asian groups don't fit into this general population waist circumference size. So this table is actually been designed for people from an ethnic minority. And it's interesting because what we can see is that what is low risk for the general population, which should be someone of white background, white European background, is actually if that person was Black Caribbean, Black African, that actually makes them a very high risk. So that in itself just shows that if, say, we were kind of sticking to the general population ranges, people who are not white European might be missed off or being referred to specialist services. And if we're waiting for them to reach this high and very high categories, in comparison, I mean, there isn't even a very high, or there's only two categories for people from Black African, Black Caribbean backgrounds. So it just shows the importance of having a tailored, more specific, culturally appropriate range for specific groups, because it means that, one, we're getting these groups earlier, because we know that things like type 2 diabetes are becoming more prevalent at younger ages within Black African, Black Caribbean groups. So if we're not waiting for them to reach 24 centimeters for men, or or above 80 centimeters for women, it means that we're more likely to have early interventions and prevent those kind of complications associated with those non-communicable diseases such as hypertension, high cholesterol, etc. So it's been identified that we've got a high waist circumference, which has been now specifically used from using your gender and your ethnicity. So what do you now have to do? Ideally, so the recommendation is that we should be aiming for 5 to 10% weight loss, which is a modest amount of weight loss. Any kind of nutrition professional or clinician would suggest a modest amount of weight loss initially, because we know that there are loads of advantageous effects from kind of aiming for this amount of weight loss initially, and then it might be once that target is met that we look at kind of promoting more weight loss down the line.
Jasmine, quickly, let me ask a question before you continue, if you don't mind.
Yes, please.
So with that, this waist circumference, they are not taking into account the age, or that it doesn't really matter when you are looking at waist circumference.
So for this, these are adults. So yeah, so once you're an adult we're using these ranges. As you get older, still having that fat deposit, those fat stores around your middle, regardless of your age, isn't ideal. It's not good. So it's not. Whereas BMI is more, we're trying to get into more age specific ranges, because overall having kind of a bit more cushion is better for the older person. But even still, we want to try and make sure that fat is as evenly distributed as much as possible. So aspiring for more of an hourglass, or for women, an hourglass shape. And then for men, kind of more of like a triangle shape. So trying to avoid that kind of apple circular shape. I know a lot of that is, kind of genetics. we can't really too much influence our body shapes, but where we can, ensuring that the fats are kind of more evenly distributed is better. But I'll go on to a few points of kind of what happens with age, particularly with women in menopause, because that we tend to see kind of all of a sudden a lot of central weight building up, and so there are some things we can do to help manage that. Yeah. Any other questions on anything at the moment? But no, it's a great question. Okay. All right, thank you. Okay, so yeah, like I said, we're trying to aim for 5 to 10% weight loss. If for the general public, I know the red's highlighted, but that's just based on the previous slide. But if for the general public, waist circumference was above, kind of within these ranges, we want to aim for 5 to 10%. And then for Black African and Caribbean populations, if the waist circumference is above these measurements, we want to try and aim for 5 to 10% weight loss. And just for context, in terms of what 5 to 10% weight looks like, or what 5% looks like, if you were around 80 kilos, that's about 176 pounds. I'm not too sure what that is in stones and pounds. If you're 80 kilos, 5% weight loss would only be 4 kilos. And the recommended is to encourage healthy weight loss, It's about half a kilo to a kilo a week. So these are relatively achievable goals that we're trying to set and trying to enforce and trying to encourage. So we're not expecting massive amount of weight really quickly. It's gradual weight loss that you're consistent with. And then in terms of that 5 to 10% weight loss, what we can expect to see and what does happen is someone who has poorly controlled blood sugars, we'd see much more better controlled blood sugar control. We see blood pressure reduce, and we also see improved blood cholesterol profiles, which all in all makes that person a lower health risk of developing those non-communicable diseases. And if any of those diseases were present already in the diet, within the individual, then it makes that disease a lot more manageable. So in terms of, aside from these improvements, we also expect to see improved sleep pattern, improved health and well-being, improved concentration. So these are all really positive things to kind of be mindful of, because I know 5 to 10% weight loss can seem minuscule and nothing, but believe me that it works, and it has so many kind of positive effects to your health by doing that. Okay, so when it comes to what we need to do to reduce our waist circumference, so I could have put the eat well plate up, but I feel like we've probably seen that quite enough times before. And aside, and I don't want to bore you by saying healthy eating and healthy lifestyle, but to be honest, it literally is as simple as that. So if we just kind of wanted to highlight the main points we want to try and focus when it comes to trying to aim for reducing waist circumference. So fats within our diet are really, really important, but it's just being mindful of where we're getting those fats. So things like saturated fats, which we get from animal products, full fat dairy, butters and palm oils and coconut oils. Those have kind of a bad, a negative impact on our health. They are more likely to be stored, but if they're not burnt off, they're going to be stored as fat. And they also increase our types of cholesterol as well. So we want to try and reduce that down, because we want to try and reduce our risks of developing any non-communicable diseases, and instead replacing them with more unsaturated fats. So these would be our vegetable oils, our olive oils, rapeseed oils, sunflower oils, avocado oils, and seed oils. So that in itself, just doing that swap, we're improving our will improve our cardiovascular health and help to reduce kind of any additional fats which could potentially be stored around our middle. We want to try and increase our intake of fruits and vegetables. We know that they're full of antioxidants. They're going to help clear away any kind of things called free radicals, which could be roaming around within our bloodstreams, and help. So that'll help to clear those away. It's also a source of fiber, which we know is really cardioprotective, so great for our hearts, but also really great in terms of managing and preventing type 2 diabetes from occurring. It's got kind of also some positive effects on other diseases, so and preventing other diseases, particularly some cancers as well. So without kind of trying to repeat too much on, I guess, other talks which have happened, but so just to really highlight the importance of reducing fats and really increasing our intake of fruits and vegetables. Limit alcohol, not just beer. There's definitely a myth among men that drinking a lot of beer causes a beer gut. Part true, part not true. Whether it's beer, rum, whiskey, alcohol pops, it can result in a beer in a belly, a beer gut. So it's not to say that you want to swap from one alcoholic beer to a different alcoholic beverage. Alcohol.
I think that's really common with us men.
They go, oh, it's a beer gut. I won't drink beer anymore. I'll have wine. It's like,
people like to get rid of the beer tummy get rid of the beer tummy. So people prefer the spirits to beer. So glad you are saying that it doesn't matter.
It's alcohol in itself can be sometimes labeled as empty calories, and by that it's so that phrase means that it's giving you is calories. There's nothing else really. Some might argue that wine gives you, a bit of antioxidants. I mean, it does, but it's a very, very small amount of wine for you to get the antioxidants, those health benefits. But once you kind of get to a standard glass of wine, you've got there's more negatives than there are positives of having that glass of wine. So don't be disillusioned and think that just because you've cut out beer and you swapped to a different alcoholic drink, or you've cut out beer but still having foods which are quite high in saturated fats, that the belly will go. That's not the case at all, unfortunately. And then also on carbohydrates, so it's just to be, I can't really see it. I don't know if you can, there we go, a little bit. So it's just making sure that we're choosing carbohydrates which are more fibrous, such as boiled yam, green bananas, green plantain, as opposed to maybe going for the swallows, the really ripe and sweet plantain. Again, for the reason that if it's more fibrous, it's going to take a longer time to digest in our stomachs. We're adding a bit more, so we're adding some probiotics into our diets as well. The fiber in itself will help to reduce our peaks in blood sugar, helps to reduce those kind of those high raises in blood sugar and then those dramatic drops in blood sugar, which means that we're not craving foods later on. And just in terms of glucose control, we know that having diets which are full of a bit more refined sugars can lead to an excessive amount of sugar kind of circulating in our body. Insulin sensitivity is not as great, so that can contribute to weight gain all over, but it can also kind of eventually lead to weight gain around our middles. So just something to be mindful of. And then I just wanted a few points around a bit more of a targeted approach in terms of kind of waist circumference. So like I mentioned, so I know, so when women go through just factor of life, cycles end, we go through a perimenopausal, postmenopausal phase. So the perimenopausal phase being that window where the periods, those cycles are beginning to stop. So our levels of estrogen, which is a naturally occurring hormone, and helps to guide and govern the menstrual cycle, one of kind of a few other hormones, but that is pretty much stops as a result of menopause. So we know that soybean products, things like edamame, soybeans, it could be what word now, goodness, tofu, tempeh, those foods are full of something called phytoestrogens, which are similar to estrogen and almost kind of like mimics its reaction in the body. So that can help to, one, it's an additional vegetable, which is great for the body. Our bodies love that. It's an additional source of fiber, but it can also help to contribute to weight loss in that it can help to reduce our kind of our want or cravings for certain foods and a bit more carbohydrates. So incorporating some of those phytoestrogens can also help with some of the symptoms of menopause, kind of like the hot flushes. But yeah, we do know that once women do go through that menopausal phase, estrogen, which is involved in loads of other things other than just our cycles, but kind of like our bone cycling. Estrogen is also involved in where the fat is distributed. So kind of having something like soya products can help to mimic what estrogen would naturally do within our bodies. So something to consider and incorporate into our diets. In terms of another way to try and reduce or manage how we're eating, something like intermittent fasting, where you've got a bit more of control, a bit more guidance on kind of windows where we can eat. So it could be that there's I guess a number of ways people can do it. It's either we shorten the window of eating within the day, or we have 2 days in the week where we have a more of a reduced calorie intake, but then the rest of the days in the week are eating more of a balanced diet. So using one of those ways can help to reduce our unnecessary calorie intake, and also means that we're burning kind of our reserves that we have within our fat stores. And when we're trying to reduce our portions, we want to particularly focus on those carbohydrate portions that we're having. So trying to reduce the intake of our rice, our potatoes, pastas, those sorts of foods, which are going to have a much higher effect on our blood glucose control. And if we're not burning that energy, it can easily be stored as fat. And if we're, if we've almost filled up the fat stores elsewhere in our bodies, and it tends to go towards our middle. So we want to try and focus on that as well. And then also we want to think about exercising. So exercising is really important, and just staying active is really important. But something like high interval training has been shown to be kind of specific, quite effective in terms of trying to reduce our waist circumference. And it's just being mindful. So it might be that we do a led training course with a fitness instructor, or it could be something simple as if you are walking or cycling, you kind of have a few moments where you're walking really vigorously, then kind of go to a slower pace, and then start walking fast again, then go back to a slower pace. So you're challenging your heart, you're challenging your metabolism, you'll get your body's having to trying to use or trying to get energy really quickly. So it will either, once it's used its carbohydrate stores, it will then use its fat stores. So a combination of strength training, but also some high interval training can help to reduce overall weight size, but can also target your waist circumference size as well. And just a few take-home messages just wanted to highlight. So when it comes to non-communicable diseases, the main factors that we're looking at are detecting, screening, and make sure that screening is targeted and that we're using appropriate parameters for the group that we're trying to target. So in that slide before, that table for the general public isn't necessarily going to be appropriate for someone from a Black African, Black African or Black Caribbean background, because if we waited for those waist circumferences for, say, women to reach, above 80 centimeters, and there's a risk that there's too much damage has been done already. So trying to get that early intervention really, really quickly is really important. Whether we are clinicians or patients off to see a clinician, asking for waist circumferences as part of an assessment is really, really helpful. Weight by itself is okay, but I think we need to just get more into the habit of asking, taking waist circumference measurements, because like I said, it's a way for us to one, have more body positive conversations, and two, as a way to try and encourage early intervention. And when it comes to making those diet and lifestyle changes, these are kind of combining diet and lifestyle changes will help to reduce overall body size or body weight, but will also focus on waist circumference as well. So it's the two combined. And also it does take time. I know people often think or try to incorporate sit-ups or ab exercises to try and target just the stomach, but unfortunately weight loss doesn't work like that. We have to kind of focus on a whole body approach, and with time the weight around our stomach will go. And on that note, I believe we've got some time for questions, and if you want me to go over any of the slides as well, that would be great.
Wow, that's interesting. Thank you very much, Jasmine. Really, really interesting. So it's now time for questions. I'll start with a few that I have. I think really this is just like the idea they had for the BMI, a quick way that we could access or quickly access what is happening with yourself. But given that this one at an individual level is really, really tailored and can really do the job. What I wanted to find out was, is there a special tape that we should use if we are to measure our waist circumference?
A standard, I mean, from my own learning, it's definitely a measuring tape that is long enough. I have been caught out in clinic where, and kind of both myself and the patient were slightly, I wouldn't say embarrassed, but maybe it'd be a bit uncomfortable where it wasn't long enough. So I had to kind of stop halfway and then like kind of measure it again. But I've just got one with me. So it's just a standard tape measurer that you get in a sewing kit. Is perfect. It tends to have centimeters on one side and inches on the other. So you can convert it for both. And yeah, just kind of making sure it's more the location of that measurement. So like I said, just below the rib, just above the hip, find the middle, and take that measurement around.
Okay. All right, thank you. So that means I think in most of our homes we have this, as you said, sewing kit. There will be a measuring tape or anything in it, so that we could measure and go back to compare with our with the guidelines to see where we fall. Another. Let me see if anybody has a question. Let me ask the last one before I give it. There's no. So the other one was to look at the ways of how to reduce our waist circumference. Those were really, really interesting tips that you give. I wanted to find out, my wife mostly says, oh, don't eat this late because you end up putting belly fat. Don't do this. And what has the time of the day eating had to do with my waist circumference?
Does the time of eating, so does the time of day we were eating affect kind of where your fat is stored? No, unfortunately not. So I guess you could go back to your wife and you could say, you know, it could go to your arm, it could go to your legs. But unfortunately, I have to say for men, you are more predisposed to store fat, additional fat around your middles. Whereas women, we're more predisposed to kind of store that fat around our hips and our thighs. That's just genetics. We thank estrogen for that. But like I said, so kind of as women get older, we go through the menopausal stage, estrogen drops, and we kind of get this fat that's deposited everywhere. But yeah, so the time of day where you eat isn't necessarily going to affect where that fat does sit. But it typically, kind of does go, for men around your tummies and for women around our hips and thighs. I think it's important also to note that where kind of within our stomach areas, it's not just, so there's kind of the different layers to where that fat is stored. It can be within our organs. That's quite serious. So it could be within our liver, within our heart, within our pancreas. And that's where we see kind of our bodies kind of struggle to, I guess, manage things like diabetes and heart health. It could be around the organs as well. So again, it makes it difficult to manage things like type 2 diabetes. But then it can also just be kind of like under that layer of skin. So that tends to be the fat that we're more likely to feel and see. But all the other fat stores kind of more internally, we don't necessarily feel or see. Just because you can't see it doesn't mean it's not there. So it's it's yes, it's still important to that's why it's for things like saturated fats, it's things like butter, animal fats, full fat dairy. It's important to try and keep those as low as possible.
Thank you. So I think we have a few questions now. So I think Dr. G. Khan, your hand is up. So I'll start with you. Are you able to unmute yourself?
I'm unmuting myself, and thank you so much, Jasmine and Evans, for the wonderful sharing of that. I want to tell Evan that actually your wife might be having some right there by telling you to eat a little bit early. And I echo what my colleague has said, but I think the thing of your wife that if you eat actually very late, you'll definitely just go to bed without an activity, which means you're not spending any energy. So whatever you have eaten, settle in, you sleep, you haven't spent. And you know, if you don't spend, the energy balance, what you take in, if you don't spend, it builds in as weight. So I think by encouraging you to eat a little bit early ensures from maybe 6, 7, 8, by the time you go to bed at 9, 10, you've actually had maybe 3, 4 hours of some physical activity or moving around to ensure that actually you don't just make that build as part of your system. And I think that's where she's coming from. And I agree with my friend that weight does not discriminate where it goes, but anyway, we know where this goes in different parts of the bodies, men and women. But I think your wife has an idea which is really very brilliant. So eating actually earlier helps because you don't really settle sedentary immediately and go to bed. If you eat at 10, then you go to sleep, you haven't spent that energy. You don't need a lot of that energy just to sleep.
Mm-hmm.
That's where she's coming from. Otherwise, thank you so much. I just wanted to put that point forward, that actually hug her when you go back, because she makes some sense.
All right, I will. Thank you. All
Thank
right,
you.
yeah. Okay, any more questions? Okay, let me read a few from the chat, Jasmine. Somebody wants to find out, you spoke about the unsaturated fats. If you could give us some examples of unsaturated fats that we could
incorporate.
Into our
so
diet.
Nuts and seeds are a great source of unsaturated fats. When it comes to nuts, you want to try and choose the unsalted, so not the honey glaze, not the nice smoky, not those ones. We want to try and choose the unsalted kind of, again, nuts where we can. And even with something like that, because it's fats, but that is still a source of calories. So when it comes to portion sizes, try and keep it to a small palmful would be the kind of ideal amount. So vegetable oils, so that would include sunflower, rapeseed. In most supermarkets, particularly within the UK, if you were to buy vegetable oil, the ingredient is rapeseed oil. So don't be tempted to go and buy rapeseed oil by itself. It will more likely be rapeseed oil. Vegetable oil will be rapeseed oil. And then, yes, other nut oils, avocado oil, those are the kind of the ones we want to use in our cooking, and of course, olive oil. And then we also have the unsaturated fats that we get from oily fish. So that's really important to try and incorporate. Ideally, we want to try and get 1 to 2 portions a week, a portion being, again, the size of your hand, or like a standard fillet. We want to try and get those sorts of foods in. And then in terms of seeds, it could be pumpkin seeds, flax seeds, sunflower seeds, and how they can be used in foods. It could be added into salads, could be added into cereals, into smoothies. When it comes to buying bread, try and get, granary or seeded where you can, or it can be kind of topped onto fruit as like a snack, or into yogurt as a snack as well.
All right, thank you. Let me add another one. So someone wants to know, Martha wants to know how often we should measure our waist circumference so that we can keep track on it. Because I think when it comes to weight, some of us have it like every month to stand on the bathroom scale. What do we do when it comes to waist circumference?
Yeah, that sounds like a good interval every month. If you're trying to match it along with any kind of blood tests you might be having, so it might be every 2 to 3 months. But I think anything more than once a month probably isn't going to be, you're not going to see much of a difference, or the changes will be so small that, it's not going to be that significant. So once a month sounds perfect. Again, for both men and women, ideally the same time of the month each time. So women, we know that we, bloat during menstrual cycles. So if we were to do kind of the same, still 4 weeks apart, or kind of a month apart, but like different times in our cycle, then the waist circumference is going to be different. So just to keep that in mind. And also is it just after you've eaten, just after a bowel movement, just as you woken up? So trying to keep the environment of when you're taking that waist measurement the same as you would do with taking weight will more likely make that measurement a bit more reactive as well, a bit more reliable, sorry.
Oh, okay. All right, thank you. So any more, you can just put up your hand or put your question in the chat and I'll read it up. Yeah. Okay, so while others are gathering their question, let me, I think I really like the part that you spoke about it not being weight, because in our community, most especially the women, they are quite afraid when it comes to talk about your weight and how you are faring with your weight. So this is a kind of a safe ground that I've seen that maybe it could encourage people to get on to keep a track on it on their waist circumference.
Yeah.
And I think, yeah, if we're able to encourage it, it might help a lot. Yeah.
Mm-hmm. And I think it also kind of follows on around the conversations on how you feel. So not just using weight as a guide to health, because as we know, weight can fluctuate quite a lot. So kind of going by how your clothes feel on you, going by how more active you're able to feel. It might be that you're able to kind of bend down and do your shoelaces, whereas before you weren't able to do that. It might be that you're able to go up and down the flight of stairs without feeling as breathless. So there are other markers of health and health risk that aren't just focused around weight. And I think waist circumference is one way in one direction, which is really good for our community as a way to measure that as well.
Yeah, which is quite interesting. Yeah, and also I think today we have also been able to know the health risk when it comes to having to put that amount of weight around our waist. So I think that is it. It's really important to know. Any more questions? Let me go back to the chat and see. Can either just put up your hand to talk or just unmute yourself and ask your question or put it in the chat. Please, yeah.
Thank you for sharing the link there as well.
Oh yes. Yeah, that's quite interesting. Yeah,
it's a really good video.
And it also captures your ethnicity and all that. You can put it in, and it gives you a nice scale there. So it's good. Yeah. I think we still have 8 minutes to go. So I'm not seeing any more questions in the chat. So what I would do is, so Jasmine, I would give you some time just to summarize for today all that you have said. Maybe most especially the take-home messages. For those that have joined us really late, I saw that a few came in really late, what they can take home, what they can implement for this week, and what they can share with family and friends as they leave this call. Yeah.
So my main take-home messages, I might actually reshare the screen in that case, and people can see.
Okay.
That'll be good. No, it's not this one. Oh, it's fine. No. Ooh. So my main take-home messages are going to be around understanding that it's really important to attend. In fact, this is a point I didn't actually mention, but often we do get invitations from our GP, particularly I know within the UK, there's definitely a push to encourage more people to attend their GP practice, to attend health centres for health checks. We have, once we hit 40, there's a general health check that happens where weight circumference, blood tests are taken to measure risks in developing certain of these non-communicable diseases. And then when women have health checks for breast cancers and men have health checks for prostate cancer. So it's just really important that we attend these health checks because, like I said, a lot of these conditions can be prevented, can be avoidable, and if they're detected early, they can be treated as well. Waist circumference. So we understand that there are a few flaws around BMI, and it doesn't take you into account body composition, ethnicity, gender, and just the fact that it's just a very, very, very old tool made in the 1800s based on European men. So that in itself as a guide for our health, should be questioned. So waist circumference almost kind of tips that on its head a little bit, and because it does take into account where our weight is being kind of carried, where our fat's being carried, and if it is carried centrally, we know that that in itself can put us more at risk of having those non-communicable diseases such as poor heart health, hypertension, type 2 diabetes, and where we can reduce our risk, we should. And then lastly, I guess back on waist circumference, when it does come to taking that measurement, whether you're doing it yourself or clinicians taking it, you can ask for a chaperone if you don't feel comfortable having that measurement taken, or you can just be told how to take that measurement yourself at home. The link has been kindly put in the chat, so if you did want to go ahead to the British Heart Foundation and have a look at kind of that short video on how to measure your waist circumference yourself, taking into account gender and ethnicity, you can do that as well. And if your BMI is within that kind of high risk area, we would recommend a 5 to 10% weight loss initially. And once we've worked that out, we're kind of looking at 0.5 kilo to 1 kilo weight loss a week, which is manageable and achievable, steady weight loss. When it comes to changes and how we can reduce our waist circumference, unfortunately, there isn't a food, a diet, an exercise that will alone lose weight on your middle. It is overall body weight loss that will happen overall over time. There are some foods and strategies that can be put in place to help guide that as well. So, like I said, trying to incorporate, so women during pre and peri and postmenopause, incorporating phytoestrogens in the form of soybean products can help, one, manage the symptoms of menopause, but also can help with that fat distribution and trying to reduce the amount of weight that is stored around our middle. Men, when it comes to, I guess, and women, beer gut is a term, but isn't just caused from beer, it's caused from all kinds of alcohol. So don't think just from switching from one to another, that's going to automatically drop some weight. We want to try and reduce overall alcohol intake. When it comes to our fat intake, we want to try and incorporate more of those polyunsaturated oils coming from vegetable products and from oily fish. And we want to try and incorporate, well, be active, being physically active daily is really, really important, but also kind of getting some active exercise in there. And something like high interval training can be really effective at trying to reduce not just overall body weight, but trying to target and help to target weight loss around our middle section as well. So those would be my key points there.
Thank you very, very, very much. I think in the chat you can see a lot of saying this is very, very informative. And thank you for summarizing this for those that joined us late so that we can have a take-home message to it and to keep up with our waist circumference. So on this note, I'd like to thank you very much. And as you said, one of the important things is also to not forget about our physical activity. And I think what we have next is Orlando to take us through physical activity so that we can complement to all that you're telling us about how to eat well to keep a good waist circumference, low risk waist circumference measure. So
I've just seen a question in the chat. Sorry to cut you off, Evan, just about.
All right, okay, yeah.
So the question was, would I recommend going to the doctor if you were at a high risk level? I would actually. I think it's important for your GP to know that waist circumference measurement. It might be that you're kind of, based on information that I've just given you and from previous talks focusing on kind of healthy and sustainable weight loss, that you're able to manage it yourself. But if your doctor is able to offer and refer you to a dietitian within the practice, then yeah, I would recommend, and if you could go for that, that'd be good.
Yeah. All right. Thank you for picking up that question.
Okay.
That was good. Yeah. So yeah, it's not about us just measuring, but if you measure, what next? What do we do? And I think, Jasmine, that's really spot on. So if you have that, and if you also look at within the link that I sent, you can, when you measure, you put it in, it gives you a scale of where you are green being, well, a risk and a high risk. so you know where you are and you can seek for further help or to put strategies in, as Jasmine mentioned, to reduce your waist circumference. So thank you very much, Jasmine. Thank you so much for today. That was really, really insightful. So I'll now pass it over to Orlando. Thank you.
Thank you, everyone. Take care.
Thank you.
You just spotlight me. Thank you, Evans, and thank you, Jasmine, for that amazing seminar today. I hope everybody's gonna stay on the call. It's workout time. We have our 4th week of box exercise coming your way. Learn some new combos and get fit and healthy in the process. Okay, so for today's session, all you'll need is plenty of space, plenty of water, and a good fighting attitude. Okay, so let's get straight into it. Let's start with our warm-up. Let me sort my music out. We're going to do nice and easy. We're going to start with just jabs. Okay, so jabs. We're in our guard. Just straight jabs. Okay, so if you are right-handed dominant, you're going to throw that left hand out. And if you're strong hand, your left hand, you're going to throw that right hand out. Okay, 30 seconds. Again, so get ready. 3, 2, 1, let's go. That going, people. 3, 2, 1. Okay, next, let's bring that dominant hand in now. It's going to be left, right, or right, left. Let's go. That going, people. 3, 2, 1. Okay, let's go into a shadow skip now. Shadow skip. That going, make sure you flick those wrists round. 5 seconds. 3, 2, 1. And that's time. Give yourself 15 seconds. Quick breather, get some deep breaths in, and then we'll continue the walk. Okay, people, straight back to your spaces. Let's continue this warm-up. Okay, so 30 seconds. Next move we've got is a jab, cross, left hook. Once again, nice and sharp. Jab, cross, left hook. 30 seconds. Let's go. 3, 2, 1, go. Left, right, left. Working out, people. 3, 2, 1. Back to your skipping now. Let's raise the temperature of that. Come on. 3, 2, 1. Last one. Let's go. Uppercut. Go. Three, 2, 1. And that's time, people. Well done. Give yourself a quick 20-second walk break, and then we're going to go into round number 1. Well done, people. Okay, people, join me back in the center. Game time to get in the ring. Let's start round number 1. Okay, so round number 1, we have a combination round. So we're going to start off in our guard, like so. Make sure you're nice and comfortable. Get a few bounces. What we're going to do, it's going to be jab, cross, hook, cross. Nice and sharp. Watch again. You guard. Jab, cross, hook, cross. Nice and hard. Watch from this angle. My guard, remember, punches are going to your face. So no punches up here or down here or to the sides. Directly to your face. So we're here. Cross. Okay, down, cross, hook, cross. That'll be your first 60 seconds. Remember, each round is 3 minutes long. Let's get into this round, people. Let's go. Okay, get ready. We're going to go to 3, 2, 1. Let's start the round, people. Let's go. I say, people, keep up, people. 20 seconds to go in the round. Keep working, people. Let's go. Two, 1. Okay, the proposed mic clock. Okay, let's add to it now. So in your guard, cross, hook, cross, hook, cross. Add in another hook, another cross. Back again. Cross, hook, cross, hook, cross. Let's go. Seconds to go. You're going to go. Three, 2, 1. Okay, it's a few minutes and 1 to go. Let's add to it again now. So what's the whole combo then? Over here. Cross, hook, cross, hook, cross. Now we're going to add an uppercut, cross. Watch again. Cross, hook, cross, hook, cross, uppercut, cross to finish. Last minute, people, let's go. Come on. Let's go. Seconds, people. Three, two, one, and our time, people. Bell go back to your corner. Take a 30-second break, and then we're going to round the 2. Well done. Fifteen seconds, people. And we're going into round number 2. Okay, people, join me back in the middle. Back to it now, back in the ring. Okay, so next round now, we've got a movement round. Okay, so combo with some movement. So we're going to be in our guard here. So we'll start the round with some movements. We're going to push from our back leg, 2 steps forward. Okay, watch again. In our guard, pushing from this leg, 2 steps forward. Once we get there, we need 6 punches. 4, 5, 6. And then we're going to bring this back leg to the side here and have a cross right there. Watch again. So here, 2, 6, 6, pivot back. So this front foot here, turn back there, and we go bang, cross, pivot back, here, back in your guard. Watch one more time. 2 forward, 2, 3, 4, 5, 6, spin, bang, spin back, and you're back to where you started. Okay, let's try that, people. So from there, we're going to split this round into 2 90-second segments. Okay, 2 90-second segments. So 2 steps forward, 6, drop that back leg, bang, bring the back leg forward, back to the start. Let's try that, people. Come on now. Let's try that now. Okay, start your guard. Remember, pushing from that back leg first. 2 steps forward, 6 punches, boom, pivot, cross, pivot back. Let's go. 3, 2, 1, go. Back. Let's go, people. Start slow once again. How do we speed up a little? Let's go, people. Keep going. Seconds before we add to it now. Keep it going. Keep that movement sharp. Let's go. 2, 1. Okay, stop the clock right there. Okay, so watch again. 2 forward, 6, pivot, 1. From there, we have 10 uppercuts. So we're going to go here, start with left hand. 1, 2, 3, 4. For 10, then pivot back. Watch again. 2 forward, 6, 1, 10, and then back to the start. Let's go, people. Second half. 3, 2, 1, go. Let's go, people. Forty seconds left, people. Last 15 seconds. Keep going. Three, 2, 1. And that's time. People back to your bonus. 30-second warm break. And then again, round number 3. Well done.
Thank.
Okay, people, join me for the third and final round. So this third and final round, we have a cardio round mixed in with plyometrics, which is basically like bounding exercises, so jumping exercises. Okay, so I'll give you the jumping exercise and I'll give you the variation too, if you're not quite up to the jumping part of the exercise. All right, so we'll start off in our guard. Okay, so this is going to be split into 6 30-second segments. So we'll start with a punch and then it'll be followed by the jumping or plyometric exercise. Okay, so watch me nice and close here. So we're going to have 2 straights, 2 uppercuts. Straight, 2 uppercuts. Keep working through that for 30 seconds. Change it, back, back, change. And then from there, we have burnouts. So we're going to be on our tiptoes here, on the balls of our feet. Heels off the ground. I'm just going to be jumping like so, bounding like so. If that's too much there, then just go calf raises. So again, feet flat, And then raise onto the balls of your feet. Raise onto the balls of your feet. Okay. So if you are able to, fine. Burnouts. If not, then we'll go calf raises. Okay, that's your first minute, people. Okay, and we're going to change it on the minute. So remember, 1, 2, 1, 2, 1, 2, 1, 2, 2, 1, 2, and then burnouts. 30 seconds apiece. Let's get into the drum, people. Let's go. Come on. Let's go. Okay, remember, 2 straights, 2 uppercuts. 30 seconds straight. Get ready. 3, 2, 1, go. Come on, people, keep going. Come on. 3, 2, 1, burn out. Let's go. Keep going. 15 seconds. Keep going. Keep going. 3, 2, 1.
Apologies, everyone. I think we may have just lost Orlando due to some technical difficulties, so please just bear with us as we try to reconnect with him. I'm sure you guys were enjoying the exercise session on the combinations, so please just bear with us while we reconnect with him. Thank you. And he's back. Welcome back, Orlando. Sorry, we lost you there due to some signal error.
Oh, you still there?
Yeah, we're still here.
You're still there? I'm walking now. Okay, yes, sure. Let's continue with that round, people. So we were here. Hook, up for 30 seconds. Let's restart this clock. Not giving you any charity. 3, 2, 1, let's go. Let's go. 30 seconds, people. Keep that going, people. Keep that going. Three, 2, 1. Okay, next move. We're going to be bouncing on one leg. Okay, if you can, let's try and hold and bounce. We're going to bounce 15 seconds per leg. Get ready. 3, 2, 1. Let's go. Okay. Three, 2, 1. Okay, last minute now. Uppercuts for 30 seconds. Nice and sharp. 3, 2, 1. Go. That goes, people. 10 seconds. 3, 2, 1. Back to your burnout, so count raises. Let's go. Balls to your feet. Bounce. Ten seconds. Keep going. 3, 2, 1. That's time. Well done, people. Take a quick 30-second water break, and then we'll stretch off. Well done. Ten seconds, people. Okay, people, join me back in the middle. Let's stretch the body out. Let's start with the neck. Gonna bring our neck side to side. Let's go. Down and back. Here's the shoulder. Nice and gentle. Okay, get on the chest. We'll drop this side of the elbow. Okay, same arm, try and touch the ceiling. Great job. Same arm, try and touch the ceiling. Hands on the waist, big sensations, all the small flicks out. Same direction. Front to back. Okay, shake it all off, people. That's the side. Well done. Sam, are you still in the building?
Yes, sir. Thank you very much.
Well done.
That was a brilliant session. Great combinations as well. I'm sure the people enjoyed it. Thank you everyone for tuning in today, taking part in the physical session at the end, as well as learning from Jasmine earlier on, telling us about circumference and how important that is to keep our weight at a healthy level. Well, we'll see you next week, same time, same place, same instructor, giving you that hard work. So please tune in. Thank you very much. Bye-bye.
Well done, everybody. Peace out. Have a great evening.